Today, the FDA and the CDC announced a temporary pause on the Johnson & Johnson COVID vaccine. This comes as they review 6 cases of an extremely rare type of blood clot linked to people who received the vaccine. The U.S. cases were observed among women between the ages of 18 and 48. To date, 6.8 million people have received the J&J vaccine. That would mean there's less than a 1 in a million chance of getting a clot. Now, just to put this in perspective, according to the CDC, 900,000 men, women, and children get clots each year, leading to about 100,000 deaths. In fact, certain types of birth control pills increase a woman's risk of developing a blood clot by 2 to 4 times. The CDC's Advisory Committee on Immunization Practices, which advises the Public Health Agency on vaccine uses, is holding a special meeting tomorrow to review the J&J data. The top COVID advisors at the White House moved swiftly to calm nerves and assure Americans that there's more than enough vaccine to go around despite the pause.
Let me start by saying that this announcement will not have a significant impact on our vaccination program. We have more than enough supply of Pfizer and Moderna vaccines to continue the current pace of about 3 million shots per day.
The pause not only allows us to take a look at the cases and learn more, but it is also a signal out there to help the physicians. So you're talking about tens and tens and tens of millions of people who've received vaccine with no adverse effect. This is a really rare event.
President Biden also tried to reassure Americans.
I made sure we have 600 million doses of the mRNA, not of either Johnson & Johnson and or AstraZeneca. So there's enough vaccine that is basically 100% unquestionable for every single solitary American.
This afternoon, Pfizer announced that it will ramp up production of its vaccine and can deliver 10% more doses by the end of May. Joining me now is Dr. Vin Gupta, critical care pulmonologist. I'm glad you're here, Dr. Gupta. Can you first start out by explaining, they have paused the J&J vaccine. Tell us about these clots and how much at risk are our friends who've gotten the Johnson & Johnson vaccine in?
Good evening, Joy. Good to see you. The clot that we're worried about, it's called a cerebral venous sinus thrombosis, technical terminology, but it's basically a blood clot in your brain. And in the 6 individuals that received it, 1 passed away. The incidence rate, as you mentioned, Joy, is extremely rare, about 1 in 1 million. Just to give some context, this event, let's say we're not in a pandemic, we're not talking about vaccines, happens in about 3 to 4 cases per every 1 million individuals at baseline. So this is exceptionally rare, lower than the background rate. For those of you who've received the Johnson & Johnson vaccine, particularly women between the ages of 20 and 50, that there seems like there's this predilection for this to happen in that cohort, again, vaccine or not. If you have a severe headache, if you've had blurry vision, if you've lost, say, control of a limb, for example, really just a sort of symptoms out of nowhere, that's when you want to present your clinical provider. Those are extreme symptoms associated with this clot, Joy, and that's what should really tip us off. As to how concerned we should be, the pause is necessary in part because of what Dr. Fauci said. It's to alert folks like myself and my colleagues that this is happening extremely rarely, but that this needs to be treated differently than the way you would typically treat a blood clot. Typically, you get a blood thinner. In this case, you actually get a very different type of therapy. So this serves many purposes.
So basically, the bottom line being, people shouldn't panic if they've gotten the Johnson & Johnson vaccine unless they have one of these severe symptoms. And basically now your doctor will just kind of know what to do if you do present with these kind of symptoms, right?
Absolutely. This is to flag people who receive the vaccine that these are exceptionally rare symptoms. This is unlikely to happen to you. But if you are noticing one of these, to raise the hand, call your provider, and get anticipatory care as opposed to care that's delayed.
Got it.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.